Bismillah ar-Rahman ar-Rahim. This is an overview of psychiatric disorders. The prevalence of lifetime psychiatric disorders, as we show in this figure, this is the prevalence of some of the most common psychiatric disorders, namely depression and anxiety disorders and substance abuse, namely alcohol dependence. The prevalence of major depressive disorder here is 17.1. Sometimes it amounts to 20%. That is 1 from each 5 of the population are exposed or expected to have depression at some time during their lifetime. The combined prevalence of all anxiety disorders amounts to like 25%. That is 1 from each 4 persons are expected to have at least one anxiety disorder. The prevalence of alcohol dependence here is 14.1, but actually it differs from one place to another and sometimes replaced by other substances. Bottom line, psychiatric disorders are not rare. To the contrary, they are common. So, what is the problem? There is issues with psychiatry, namely the diagnosis, the etiology, and the treatment. First, diagnostic issues revolve around how to differentiate a psychiatric disorder from normal at the first place. So, because many of the psychiatric disorders have continuity with the normal. For example, depression. Depression is a very normal human experience. So, when can we say that someone is having a depressive disorder? This is a problem. Difficulty to determine what is considered abnormal. This is the consequence of the first point. The second point is cultural consideration. What's considered normal in a certain culture is considered abnormal in another one. The fourth issue is that there is no biological diagnostic test. So there is no blood testing or X-ray or MRI or something that can diagnose psychiatric disorder. So to resolve this problem, the diagnostic systems came up with the diagnostic criteria. Diagnostic criteria are the result of statistical studies and require. So there is certain requirement that should be fulfilled to a diagnosis can be made. These requirements are symptoms, certain number of symptoms, for certain duration. The symptoms in this duration is causing impairment in the functioning level. Impairment of the functioning level meaning that, for example, if I am a housewife, I could not do my duties in this period. If I am a student, if I am an employee or something, so whatever my function is, I am not capable of doing it well. So this is the third item, which is impairment of functioning level. The fourth item is exclusion of other medical or psychiatric causes. So all of these 4 criteria must be fulfilled in order to diagnose a psychiatric disorder, to solve the problem of decreased reliability and validity of diagnoses. About the etiology of psychiatric disorders along centuries ago was attributed to possession, demonic possession, witchcraft, evil eye, or whatever full of superstitious thinking. Nowadays, it is thought of the etiology as a biopsychosocial etiology, meaning that there is biological, psychological, and social factors involved in the etiology, and hence those three domains must be attacked in the treatment. The biological factors start from genes, which produce proteins of abnormal nature. This may be abnormal neurotransmitters or predisposed to structural changes or hormonal abnormalities. The mode of inheritance in psychiatry usually is not a single gene. To the contrary, it is genetics and environmental factors, and the genetic factors are not also a single gene, but multiple small risk factors have cumulative effect. As we see in this slide, the highest heritability belongs to bipolar mania disorder, followed by schizophrenia, then unipolar depression, alcohol dependence, and lastly anxiety disorder. Neurotransmitters abnormality include many neurotransmitters like acetylcholine, dopamine, serotonin, norepinephrine, and GABA. For example, acetylcholine is decreased in organic mental disorders. Dopamine is increased in schizophrenia and psychosis. Serotonin decreased in depression and OCD and increased in schizophrenia and psychosis. Norepinephrine decreased in depression and increased in anxiety. GABA is decreased in anxiety and schizophrenia. Second are the psychological factors. There may be premorbid personality traits, conflicts, or cognitive errors. Premorbid personality like schizoid personality in psychosis, paranoid in delusional disorder, obsessive personality in obsessive compulsive disorder, histrionic personality in dissociative and conversion disorder, and type A person in psychosomatic disorders. Social factors like family pathology, certain demographics, stress for life events are all involved in the etiology of psychiatric disorder. Classification of mental disorder. This is about the. We have a diagnostic system called DSM-5. There is the ICD-10 among others. The DSM-5 is the American classification system. In the DSM-5 we have a long list of psychiatric disorders as this slide and this slide. To differentiate between them, at first we should exclude neurocognitive disorders, dementia, delirium, and amnestic syndromes. The exclusion of this is by exclusion of any abnormality in consciousness or memory or other higher cognitive functions. If any of these are effective, we are here in this group, the neurocognitive disorders. Closely related to it is substance use disorder, where is a high specific biological factor present, which is the substance abuse. Second step is to exclude or prove the presence of psychosis by the presence of psychotic symptoms. Psychotic symptoms are either hallucination or delusions. Hallucinations are perception without stimulus. So people are seeing things which are not there, hearing things which are not there, and so on. Delusions are beliefs which have three main criteria. They are false, they are fixed, and not in harmony with the patient culture and education. For example, someone who assures that he is the final prophet, he is whatever, okay, he may be God himself, okay. These are delusions. In psychotic disorders, there is what's called lost or impaired insight, meaning that the patient himself does not know that he is a patient, does not know that what he is seeing is not true, what he is believing is not true. He is not aware of this, and hence he is not aware of being disordered or patient in the first place. Psychotic disorder will go into a differential diagnosis of schizophrenia, schizophreniform, schizoaffective, delusional, pre-psychotic, culture-bound syndromes, and mood disorder with psychotic features. Third step, after excluding organic pathology, after excluding psychosis, is to exclude mood. Mood disorder is characterized by imminent mood, whether depression or elation, which is the opposite of depression. So the patient will be or show episodes of depression, mania or hypomania, or mixed episodes. Fourth step is to search for somatic symptoms and factitious disorders. These symptoms present with prominent somatic symptoms. These disorders present with prominent somatic symptoms. It include somatic symptom disorder, conversion disorder, illness and anxiety disorder, psychological factor affecting other medical conditions, and factitious disorder. We will know about the details of them in our course. The fifth item will be anxiety, obsessive compulsive, trauma, and stressor-related disorders. All of them characterized by the presence of anxiety. The sixth item which we should search for is dissociative disorder. In dissociative disorder, there is a disruption in the integrated sense of self. This may involve lapse in autobiographical memory, so amnesia of the patient name, age, house, whatever. So there is a problem with the autobiographical memory. Or feelings of detachment from one's own self. This is depersonalization, or from one's own surroundings. This is derealization. The seventh group will be eating disorders, where there is anorexia nervosa or bulimia nervosa. The eighth item is personality disorders. In personality disorders, there is enduring pattern of inner experience and behavior that deviate markedly from the expectations of individuals' culture. So this is to delineate abnormality. They are pervasive, maladaptive, and cause significant impairment in social or occupational function. So in the different types, there will be different symptoms specified, but what's common between all the subtypes are these. They are pervasive, that is dominating all the areas of functioning of the individual. They are maladaptive, causing impairment of functioning or impairment in social relations or whatever, and cause significant impairment in social and occupational function. Childhood psychiatric disorders, that is, those are disorders characterized by onset during childhood. The most common is ADHD, attention deficit hyperactivity disorder, autism spectrum disorder, conduct, learning disability, And of course, all of these disorders we have mentioned before could present early in childhood. So we may have depression, psychosis, mania, or anxiety disorders in children. And thank you.